Hello everyone, welcome to GrowMed. Welcome back to another series where we are discussing 10 most important topics from every subject, and in this video we will be discussing from the orthopedics. Okay, so already I have uploaded the videos on the other subjects, so the link will be given in the description box. So do watch that videos as well, as these videos are like highly effective in your last minute revision because it contains all the most important as well as the repeat topics which you must know. Okay, and mainly from the orthopedics, the questions are asked like in integration with the other subjects from the anatomy, from the radio, because they'll be giving the X-ray, right? Fractures ke X-ray de denge and they'll ask which fracture it is. So it comes in integration with the radio. Then nerve injuries comes in integration with the anatomy. And one important thing from the anatomy, the nerve injuries, I have uploaded all the videos, matlab a complete video on this one, and the link will be given in the description box. So do watch that video as well, and some various other diseases like the rheumatoid arthritis and the various bone tumors, and all these are also discussed in the radiology as well as in the um, medicine and surgery. So do watch those videos, and orthopedic is like if you integrate it with all the subjects then you can easily complete it. In this video we will be discussing the questions particularly which you must cover from the orthopedics, and most important question is the splint. So questions are asked on this splint, so we will discuss the splint, what kind it is and why it is used, along with the images. See, the first image, it is the knuckle blunter splint, and we can come to know by the name itself that these knuckles, no, these are bent using this splint, so easily it is called as a knuckle blunter splint. And this one is used for the claw hand palsy, and the claw hand palsy happens because of the ulnar nerve palsy most commonly. Then second most common is the median nerve. Okay, so claw hand palsy, whenever you see knuckle blunt splinter we will be using. Then cock up splint, so you can see that cock up matlab the fingers are made like this upright, so isliye cock up splint used for the radial nerve palsy. Then the next, this is called as a thermoskin wrist brace, and this one is used for the carpal tunnel syndrome. Then the next splint is called as the mbbs brace, and this one is used for the scoliosis. As you can see here, that scoliosis matlab ki abnormal shape of the vertebra, right? The vertebra ki aise shape ho jati hai, and to make the vertebra straight we need to put a splint, and that one is called as the mbbs brace splint. Then this is also PYQ, and this image is called as the aeroplane splint, used in case of the brachial plexus injury. So मतलब aeroplane की wing आपको याद आ जाएगी ना ये image देख के, so you can remember that aeroplane splint. Then the next splint is the Bowler Brown splint for the femur fracture. Okay, so what we'll be doing here is, you can see here these two structures. So यहाँ पर हम weight देंगे, कोई भी weight मतलब so much so kilos we will be giving the weight, and we will be keeping the femur head like this here along with the plaster and all, and we will be allowing it to heal. Okay, so this is also an important image. So these were the important splints which you must know. Then moving on to the another one important splint, that is the Dennis Brown splint. So this is the image of this splint, and this splint is used to treat the club foot, which is also called as CTEV, congenital tapis equus varus or the valgus. Okay, so this is the club foot, and what we will be doing is we will be putting this splint to make the legs, the foot straight. Okay, then there are various types of the club foot. This one is the varus, this one is the valgus type, equinus, and the calcaneus type. Okay, so image based questions have been asked on this club foot also, the types, and you need to remember these images. The perfect management or the management of choice for this club foot is the triple arthrodesis. So what happens in this triple arthrodesis is three bones triple. Arthro means joint, three joint, and desis means combination मतलब fusion. ठीक है, तो we will be fusing three joints in this, that is the subtalar joint, talocalcaneocuboidal, and talonavicular joint. So this was a PYQ asked, that in triple arthrodesis which all joints you will be fusing, and these were the three joints which we will be fusing. And image based question was also on this also, that which kind of splint it is. Then now we will discuss some important fractures, and these are all the repeat topics from the orthopedics, and expecting a question from this fractures in the upcoming July exam also. So the first image you can see here that it is the fracture of the radius. So you can see here that the radius is fractured and there is also dislocation, so radio ulnar dislocation. Okay, so this one is a famous image. So you need to remember this. Image based question can be asked, like just giving this image and they'll ask which type of fracture it is. So it will be the Galeazzi fracture. And if they ask what will be happening in the Galeazzi fracture, so there will be inferior radius involvement and radio ulnar dislocation. Then the next image, Monteggia fracture. So Monteggia fracture in this is also a fracture of the hand and hand bones, and superior ulna is fractured. You can see here that superior ulna is fractured and there is radial head dislocation. So radial head is dislocated at the elbow joint. Here there is radio ulnar dislocation. Radial head is dislocated at the ulnar joint, but here the radial head is dislocated at the elbow joint. Okay, so these things, two things, if you see now, you will be easily able to come to know that whether it is Galeazzi or the Monteggia fracture. Then another two important fractures involving the wrist are the Smith and the Colles fractures. So how do we differentiate them? See, in Smith fracture what happens is that there will be distal radial fracture plus volar displacement, means the anterior displacement. So you can see here that there is anterior displacement of the bones and this is called as a garden spade deformity. So PYQ, and also this image is also a PYQ. Then Colles fracture. In Colles fracture there will be displacement radial fracture. Okay? Distal radial will be fractured. Here also distal radial is fractured. But the differentiating feature is this displacement. So in Smith there will be anterior displacement, whereas in Colles there will be the posterior displacement, as you can see here that the bone after the fracture is displacing posteriorly, and this gives a very famous deformity called as the dinner fork deformity. As you can see here that the hand looks like a dinner fork, and this is also a PYQ asked, and the cast used to treat this Colles fracture is the hand shaking cast. Okay, so this is an also important and image based question is being asked on this cast. We'll discuss those also now. So these are the four important cast which you must know, and the first one is the hand shaking cast. This cast is used for to treat the Colles fracture, as we had discussed here. Hand shaking cast, Colles fracture. Then the next one is the glass holding cast, and this one is used to treat the scaphoid fracture. The next cylindrical cast used for the patellar fracture, and then the hanging cast which is used for the humerus fracture. So this was an important cast. Now another very important topic, hip dislocation. Okay, so one thing you need to note down here is that in the exams all time there is a question coming on this hip dislocation, whether on the anterior dislocation or the posterior dislocation. Image based questions have been asked, or also what will be happening if there is anterior or the posterior hip dislocation. So you can expect a question from this one, and if not this, then the question can be like some elbow dislocation or the shoulder dislocation. So in case of hip dislocation, the nerve injured is the sciatic nerve. So important. Then let's look at the X-ray images. So this dislocation is the posterior dislocation, as you can see here that the femur head, so it is going towards the posterior side, and this bone is being appreciated more clearly, whereas behind this one there is the head of the femur. So this one is the posterior displacement, and the changes which will be happening in case of posterior dislocation are the flexion, abduction, internal rotation. So these are remembered by the mnemonic FADIR: flexion, abduction, internal rotation, and there will be limb shortening seen in case of the posterior. See, in the question they can describe that a road traffic accident patient came to the emergency, and on examination you find that the hip is in the flexed form, abducted form, and internal rotation form. So which kind of fracture it is or hip dislocation it is? So you need to write the answer as the posterior dislocation. Okay, so if simple one liner is asked, then it will be easier, but if clinical case is also asked, then you will be easily able to solve it just by remembering these things. Then the anterior dislocation. So in the anterior you can see here that the femur is femur head is dislocated anteriorly, and you can see here that femur head, so it is not overshading the pubic bone, and this is appreciated clearly. Then the changes seen in the anterior are the fiber, which can be remembered like the flexion, abduction, and the external rotation, and there can be limb lengthening seen. And in case of anterior dislocation, femoral nerve also can be damaged, whereas the most common is to damage the sciatic nerve, but sometimes femoral nerve also can be damaged. Then these are also the images for the hip dislocation. So images can be given like this, and they will ask you which dislocation it is. Okay. And another one important thing is that further this kind of dislocation is seen in posterior hip dislocation. Along with that, TB hip arthritis also, these changes can be seen. Then so various nerve injuries which are involved, where various nerves which are involved in case of the dislocation. So in case of knee, there will be common peroneal nerve injury, elbow ulnar nerve injury, and the most common elbow dislocation in case of children is the elbow. And brachial artery is also damaged in case of elbow dislocation. Wrist median nerve, shoulder axillary nerve, and shoulder dislocation most common is the anterior type. And in case of hip, we have already discussed that the sciatic nerve is involved. Then moving on to another very important topic, that is the Gustilo and the Anderson classification, which is used for the open fractures, and in this we will be calculating the risk of the infection. There's no need to remember this whole table because you know it is like a bit confusing. The things which you must remember from this table is, I'll be marking those things and you need to remember that thing because questions are asked on that. So you need to remember the classification 1, 2, 3, A, B and C. So this is the thing which you must remember. And then now what we will be looking in this classification is the soft tissue injuries. So in 1 it is low, in 2 it is moderate, and 3 it is classified into the extensive. Matlab 3 matlab extensive. And how do you classify it into A, B, C? So it will be based on the tissues involved. Like if the soft tissue only the upper layer is involved, then it will be the 3A. If the wound is penetrating inside the soft tissue, then it will be the type 2B. And if the vessels are injured, like see here, vascular injury is present, then it will be the class 3. Okay, so it is simple. Let me say to you here that the this GA classification 1, 2, 3 again into the A, B and C. So A will be like little wound and low risk of infection. So moderate, the injury is like classified as a moderate level and there is a risk of getting the infection. But whereas in ABC, the soft tissues will be like the superficial layer will be involved, then it will be going deep, little bit deep into the soft tissues, and then it's the involvement of the vessels. So blood vessels involved, then it will be the class C. So here image also you can see that 1 में थोड़ी सी minimal injury है, 2 में थोड़ी सी ज़्यादा injury है, and 3 ABC. So you can see here that C में it is like penetrating into the whole organ and it is damaging a large number of parts. ठीक है. So this one is the classification from the Gustilo-Anderson classification. Then treatment for this fracture will be the open reduction, internal fixation with K-wire or IM nails, and along with that we can also use the plating. Okay. Then malunion and non-union. So questions are asked like fracture of which part or which bone will cause malunion and non-union. So let's look at them. The malunion, intertrochanteric fracture, it will cause malunion. Humerus supracondylar fracture, malunion. Clavicle and the Colles fracture. So this was a PYQ about the Colles fracture. Then see, as 4 options are there here, right? So they can ask a question like all of the following except kind of a question. So whichever is not then not given in the option, then you need to choose that answer. Then non-union caused mainly by the scaphoid and the femur head. So these two are also very important as asked multiple times. Scaphoid wala to at least this one is the previous year question, that non-union is seen after which of the following fracture, and उसमें scaphoid दिया जाएगा. Then let's look at another very important topic, that is the pulled elbow, which is also called as the nurse-made elbow. So this is most commonly seen in the age group 1 to 5 years, young children. And what happens in this is there's the radial head subluxation, and there is axial traction in extension and pronation phase. So the hand will be in extension and pronation phase, and for the management we will be using the flexion and the forceful supination. Okay. So this was about the pulled elbow. Then moving on to the avascular necrosis. So fracture of various bones also causes avascular necrosis, like the head of the femur. The head of the femur causes vascular necrosis because the damage is to the medial circumflex femoral artery. So a vascular necrosis मतलब नेम में ही लिखा हुआ है, ड्यू टू एब्सेंट ब्लड सप्लाई द बोन विल अंडरगो नेक्रोसिस एंड विच इन vessel is injured, it is the medial circumflex femoral. Then proximal pole of the scaphoid, this also causes avascular necrosis, body of the talus and lunate. So this is called as the Kestenbox disease, and this was a PYQ asked that a vascular necrosis of the head of the femoris is due to involvement of which of the artery. Then let's discuss some other important images which are asked in this orthopedics, and these are all the previous year questions. Okay, so the first image, it is called as the Sprengel's deformity, and in this deformity the scapula is present at the high level. So this is the normal level of the scapula, and see here on this side the scapula is present at a high level, and this occurs due to the failure of the descent of the scapula. Then the next sign, which is the Poppy's sign. So this sign is called as the Poppy's sign, and this occurs due to the ruptured long head of biceps. See, question can be asked like just giving this image and they'll say to identify the sign, or they can give the image and they can say this sign occurs due to injury to which of the following. So it will be the long head of the biceps. Then this is also previous year question. So this you can appreciate here, the patella is fractured, and the management of the patella we will be doing it by the K wire. Then let's look at another very high yield topic, that is the varus and the valgus. See, if the knee is involved, it is called as the genu. If the elbow is involved, it is called as the cubitus, and coxa is involved, it will be the hip. If the hip is involved, then it is called as the coxa. Okay. And we can remember it simply by valgum. Gum matlab ki sticking together. So knock legs. Knocked legs, this is the another name used for the knocked knee for the genu valgum, and for the genu varum it is the bow legs. And for elbow also it is the same thing. If the elbow will be touching like this to the body, then it will be the cubitus valgum, and if it becomes something like this, if it goes away, then it will be the genu knee cubitus varus. Okay, so just remember these things, and the valgum and the varum, then you can connect both of them and easily reach to the diagnosis. Then the gamekeeper's thumb, which is also called as the skier's thumb. So what happens in this thumb is it is the avulsion at the ulnar collateral ligament. Matlab in simple words, you can just remember that torn ulnar collateral ligament. Okay, so you can see here that the ulnar collateral ligament is torn, and it can trap the abductor pollicis muscle. Okay, so this is the thing, and this image based question is asked, so you need to remember this image also. See, as you can see here, मतलब कि ulnar collateral ligament पे tear हो गई है. Okay, then okay, so now the list of some important tests which we do in the orthopedics. So the Allen's test, this is a PYQ, and this test is done to check the patency of the radial and the ulnar artery. So we will do this test to look at the blood flow between these arteries, whether it's normal or not. Then the Ellis test and the Barlow's test, both these are used for the congenital dysplasia of the hip. So simple one-liner questions are asked on this test, so you need to just mug up these things. Apprehension test, so this was a PYQ, and this test is done for the recurrent shoulder dislocation. Then the Cousins test, so this was also a PYQ, and this is done for the tennis elbow. Apple's grinding test done for the meniscus injury. Trower test, again an important test. This is done for the ACL and PCL, that is with the cruciate ligaments, to look for the injury of the cruciate ligaments. And the Lachman test done for the anterior cruciate ligament injury. Thomas test done for the hip flexion deformity. McMurray meniscus and Trent-Lindbergh's test, so important from the anatomy also, and this is done for the unstable hip, and we will come to know the injury to the gluteus minimus and the medius muscle. And injury to these muscles will be causing the gait, right, the Trent-Lindbergh gait. So we will be doing this test to identify the muscle injury. Then let's discuss some important one-liners asked from the fractures, like so they can ask any of the thing in the question, like either this, like stress fracture stands for which of the following, what is the stress fracture, or they can just give like a fracture of metatarsal is called as ऐसे करके, ठीक है. So we will look at those things also. So the stress fracture, what happens is the metatarsals are fractured in this case, and I think image with thighs image based question can be asked. You can easily identify it that their legs foot x-ray will be given, and in that the metatarsals will be fractured. Then runner's fracture, it is the fracture of the fibula, and mainly the distal end of the shaft will be inward. Boxers, so this is a quite famous question, and boxers may it is the fifth metacarpal which will be damaged. And hangman, this is also a famous question. So C2 pedicles, cervical vertebra 2 pedicles are fractured. And in Jefferson's there will be the C1 fracture, which is also called as the atlas. Then the last important topics of this video, the terrible triad and the O'Downey triad. So two important triads which you must know in the orthopedic, and this was asked in the Jan 24. So the recent Jan exam it was asked. So this includes elbow dislocation, radial head fracture, and the coracoid process. So the kind of question asked was like four options were described, and they were like terrible triad includes all of the following except, and whichever is not seen in this you need to mark that as the option. Then the O'Downey's triad, so it is a triad for the knee, so terrible triad of the knee, and there will be injury to the MCL, ACL, and the medial meniscus, cruciate ligament, medial and the anterior. Okay, so these things are involved in case of this O'Downey triad. So that's all in this video, guys. Already I have uploaded a video on the one-liners which you must know from the orthopedic, so do watch that video as well, and after that do watch this video at least 1 to 2 times, so that all the important things will be you'll be easily able to recall those things, because repeating the things will create a memory, and it will help you to easily remember the things in the exam hall. And already I have also uploaded the videos on the other subjects covering the 10 most important, so do watch those videos also. So thank you so much for watching this video. If you're new to GrowMed, subscribe to GrowMed and join with me on the Telegram for more amazing stuff related to the FMGE. And thank you so much, guys. Once again, I am Dr. Padmini, your mentor for the FMGE.